am a forensic social worker, and forensic social work is a new field in social work, and we established this new unit, Family and Child Forensic Unit, at Care to Kids, and I'm the manager of this unit.
My name is Dr. Michelle Bach. I'm a registered clinical psychologist, obviously part of the unit, and my role there would be firstly to be part of the forensic investigation, in which we try and establish if and how much emotional damage a child might have suffered due to divorce or then abuse, and then secondly the process thereafter to try and make them better and heal the emotional damage.
I'm Hanlie Degener. I'm a speech language therapist and audiologist, and I'm the manager of the Care to Kids unit. And my job in this unit is to coordinate functions and also reach our strategic goals, and to make sure that the service that we deliver to children and their families is of a high standard and quality.
It's a new unit, and it's a first for the university, and it is also the first university in South Africa who have such a unit, forensic family and child forensic unit. So primary, we are going to assess children who are sexually abused. And secondly, we're also involved in highly conflict divorce cases where it's about the responsibilities and rights of children during a divorce. So we are primarily there to look at the best interest of children in South Africa.
Yeah, so we are a team of people that come together to assess, to do multidisciplinary team assessments, also do intervention from a parent-implemented stance, and trying to get parents involved in their children's everyday life. So Care to Kids is a multidisciplinary team of which includes specialist child psychiatrist, pediatric neurologist, speech language therapists, counseling and clinical psychologists. We are also working with occupational therapists, dietitians, and then Prof. Cornelia, which is our forensic social worker.
If a child's coming for a sexual abuse assessment, there's also a lot of trauma usually for the child. So this unit will make it possible for us to send the child to another professional in our team for some trauma debriefing. Another child need maybe have communication problems, then we'll send it to the speech therapist. All the research point to that these services must be done in a more multidisciplinary team and not only by a forensic social worker. And that's the uniqueness that we establish in this unit.
So mediation is a way of us trying to get parents to get to a point of amicable agreement to the benefit of the child. So we try and reach solutions rather than getting to a point of who's the winner and who's the loser. The intervention would be to assist children and parents through this process of emotional turmoil, and to help them to heal sufficiently to have a healthy life after this. There would also be parent guidance for the parents, because they don't always know how to deal with the children in such situations, and even how to deal with each other.
Well, if we look at the clients that we see with the multidisciplinary team assessments, we will become quite aware of the difficulties families face. We do know that relationships in families is sometimes really challenging, and what happens with these children and the parents in relationships like this that's not healthy anymore. And I think the need became apparent that we can't just assess and intervene when there is developmental delay and mental health issues. We have to try and prevent difficulties that children are facing, but we also need to support families that are facing challenges. If I think about the referrals that we have had, and I think about the statistics about divorce rate, if we see what's happening in the courts, the delays in the processes, I think our team can play a very effective and very important role in supporting families going through this process. I think we can also be a benchmark, with a little bit of hard work, benchmark for other teams that could deliver similar services in other parts of the country.
Can also make a contribution to the community, and at the moment we are also busy to develop new programs for the community. From all the universities in South Africa, in forensic social workers, we are the leaders.
I've been working with children for the past 25 years, and I always say the only victim in divorce is the child. The parents make decisions which is going to influence the child's life forever. So for me, I feel like I'm being the lawyer for the child and advocating what their needs and wants and emotional needs are. There is life after divorce and or abuse. Children and parents do not have to carry this with them all the time. And if the damage is identified early enough and worked through in a therapeutic process, they can have healthy lives and healthy relationships after this.